Hello everyone, good evening. I'm Sanyukta from Beautiful Spotless Skin page and I'm sure all of you are doing good. So today we are here for a session with an esteemed skin expert. I'll tell you about her, but before that, about the topic. So today we are going to talk about acne management. Now, acne is such a common and chronic skin condition. Most of us had gone through that phase, especially adolescents, teenagers. That is one of the biggest fears in teenagers and adolescents, that they will have this acne issue. Even with adults, that it is more than just affecting your appearance. It's just not about the appearance. It's also about how acne, hampers our quality of life, how it lowers down our self-esteem. So it becomes very important and essential to talk about acne management. And for that, we have with us Dr. Farheen Khan. A very warm welcome to you, Doctor.
Thank you so much, Sanyukta.
So before we start our conversation, let me introduce Dr. Farheen Khan, who is a distinguished dermatologist specializing in dermatology, venereology, and leprosy, holding an MD degree from KBNU Forms with a solid foundation in medicine from ELMC Lucknow. Dr. Khan has emerged as a leading figure in the field, having embarked on her career journey. She honed her expertise by undertaking a senior consultant role in Faridabad, Delhi, focusing on advanced cosmetology. Notably, Dr. Khan established her own practice in 2022, contributing to healthcare accessibility at an old charitable hospital in Rudrapur. Her commitment extends beyond clinical practice, as evidenced by her advisory role at Izzy Healthcare, where she played a pivotal role in international collaborations aimed at enhancing medical services globally. Additionally, Dr. Khan dedicates her time to Mac Hospital, a tribute to her grandfather. And this is such a pleasure to have you with us today, Dr. Farheen. Thank you so very much for joining us, first of all.
Thank you so much for introducing me here today.
So, doctor, today, as I said, we are going to talk about acne management. And acne is such a scary word because all of us, most of us rather, have gone through this. And it's just not about the oily skin or those who are acne prone, even with teenagers, adolescents, and now with even adults, we see a lot of acne cases. And it's just not about our appearance because it also hampers our quality of life, our self-esteem, etc. So today we are going to talk about how to manage acne in a proper way. First of all, what is acne? How is it? What causes acne?
See, basically it's a malady which occurs mostly in adolescence, and we call it when there is, it's occurring in the pilosity. So it occurs mainly over the face during the adolescence. There are other like n number of causes are there. So acne is basically, adolescence and hormonal changes also.
Mhm. So, hormonal changes, hormonal imbalance, many a times it becomes one of the major contributor to acne. What all kinds of acnes are there, doctor? Because many times we see very tiny dots, bumps, or many times they are, pus filled with pus. So, what all kinds of types of acnes are there?
Yeah, there are few types as well as multiple variants of acne. So types can be of comedons, that also can be of major types like open comedons, closed comedons, can be of macro comedons, which can be of little bigger sizes, and also can be
Mhm.
sandpaper comedons. Submarine. Submarine name itself is telling you it's deep-seated ones, which are little larger in size. And also sometimes there are secondary comedons also, which can be due to some application of the medications such as steroids, sometimes chemicals and all. And otherwise, there are other types also which are of later stages, can be papules, pustules, nodules, sometimes cysts and micro abscesses also.
Okay, so a lot number of or types of acne are also there. Now, many times we see acne in specific areas of our face. Many times we'll see them on our forehead or in the butterfly area or alongside the jaw. Now, do these specific areas also tell us something? Tell us that what could be the probable cause of those acne?
Of course, major of the time, like most of the time, what happens that if we are developing acne over the forehead, So of course, it is sometimes due to dandruff, that is seborrhea over the scalp, that's the forehead and causing you. Can be little plain, comedons, which can cause that, like I told you, sandpaper comedons, so which can, make you feel like grit over the forehead area. Also, some people have of application of oils on a permanent basis, so that can also causes clogging pores and causing comedons. Apart from that, some people, they use gels and wax to style their hair, which contains pomade and lanolin in kind of a wax ester. So that again clogs the pores and causes acne. So that is forehead, and if it is occurring over the cheeks area, that can be due to hormonal changes or adolescent acne. Sometimes, if it is occurring on the cheeks after the age of 25 to 30, it can be adult acne or sometimes stress acne. And sometimes the can be of smoking, drinking alcohol, your liver imbalance is there, metabolism is not proper, then also it can cause on the cheeks. And if you're using infected towels or handkerchief, rubbing face with the dirty hands, that can also cause. If it is occurring over the cheek area and the mandibular area, then it is more due to PCOS, that is polycystic ovarian syndrome. And sometimes if it is occurring with the hair, that is known as hirsutism. So it's due to that hormonal change. And if it's occurring on the mandibular area, again, it may be due to stress acne or adult onset acne. And if it is occurring below the chin area, then it may be, if a person is on oral steroids for a very longer period of time, then also it can cause acne over the chin and front of the neck.
Mhm. So now let's talk a bit about teenagers or adolescent acne. This is such a scary thing for them, as because all of us has gone through that phase, and many who are there at the threshold of teenage or adolescence, they have this fear that they'll get acne. Anything that they can do to prevent it, or some way slow down the density of acne?
Yeah, of course. See, first of all, whenever a child is attaining maturity, right? So he started to develop comedons. So we have to take care. First of all, it's job to take the person, the children to the doctor, dermatologist, where there's age-related skin care for the prone skin. So we have to prevent by application of mild retinoids first. If the person is not responding to it, then according to the stages of the acne, we move to the further. Yeah, and it
Okay.
also, can sometimes correlate with the diet also. In case of students, because child of adolescent ages, they tend to eat more of sugaries, that is chocolates, ice creams, and rest of the things.
Hmm. Right. How important is a healthy basic skincare routine? How far can it go to prevent our skin from having acne or maintaining good skin health, doctor?
See, not to touch face repeatedly with the bare hand.
Hmm.
That would be the first thing I would tell to the patient, and always try to use product in case of acne skin. Try to use products which are non-comedogenic, lightweight. Okay, the moisturizers which you should always check for the labels in the product. It should not contain containing oil in it, or alcohol or acetone. Sometimes minerals oils are also there in the products. So we should always check on the labels. We should never use those products, because it always aggravates the acne. Apart from that, we should always double cleanse our face if we have acne prone skin. To remind here is that not to harshly exfoliate your skin every time, because these days these promotions are there for chemical peels they are using by themselves in the home.
Hmm.
So it should
Right.
be used by the recommendation of the dermatologist, but gentle exfoliation where you have to double cleanse your face, not double cleanse, use the cleansers which contain like salicylic acid, glycol, or some oil is also there, which is good for that.
Right. And it's always a good idea to go and consult a qualified dermat like you for advice on what cleanser, what moisturizer, what sunscreen, what serum, etc. to go for, especially if you have an acne-prone skin, doctor?
Yeah, I always tell to my patients that of course it's good to read about the topic or about the condition on Google, but still you never know that when during that particular time frame. Also, what sort of a stage of acne it is, or what sort of a skin do you have. So I would suggest the patient to always go and talk to the dermatologist, get a proper analysis of the skin, and then depending upon their stages of acne and type of the skin, one should use the treatment dermatologist.
Fair enough. Now, a very common tendency that we have in our society is that whenever we'll have acne or anything even close to it, we'll run inside our kitchen for any home remedies, or we'll go to a chemist shop for some over-the-counter topical application. कि एक tube लिया लगाया वो ठीक हो गया. And initially we fall for it because it works wonderfully. तो हमें लगता है हमारे हाथ कोई मैजिक क्रीम लग गई है और देखो हमें डॉक्टर के पास जाना नहीं पड़ा, हमने खुद ही ठीक कर लिया. It's only when, after long usage of that cream, when we realizes that our skin is now addicted to that tube cream, whatever, we realizes that it's the condition is getting worse, and then we runs and lands up in front of a doctor. So, and then nowadays we have these influencers who have ready to go solutions for almost everything, especially skin condition के लिए तो बहुत सारी चीजें उनके पास होती है, tricks होते हैं. तो ये home remedies, these over the counter medications, applications, influencers, etc. How reliable are they? How okay it is a practice to go for this?
Like I just said, that it's always good to read more about the product, whether it be any condition. Like nobody can stop you for reading, but whosoever is specialized in particular branch, you should seek the expertise always. So you may know a lot about the product, but you may not know the application of product and the usage of the product, that basically when to use specially. And home care remedies, I would say, I am not saying that it's completely contraindicated, because studies are always coming. There are lot many studies, but yet the implementation of those studies are still on hold. But it can be cucumber. Cucumber is one of the home care remedy which is always good. I wouldn't deny for the fact that it doesn't work at all. But yeah, with that, whatever is made for the skin type, it has to be used accordingly.
Right. And what about those over-the-counter topical applications? How bad it can be for our acne or our skin?
Yeah. So first of all, there's again the stages of those complications which occur due to application of OTC drugs. Especially, there's like very common creams available, that is triple combination, cligmectin. So it contains steroid in it. So initially it gives you results like you become so beautiful and you
Right.
and everything. But gradually, with the stages, it makes your skin more damaged, and then there will be acne which will not respond to the treatment which are there for the acne. So you have to be very particular and very cautious before application of such OTC drugs. And nowadays, serums and so many, like you just said, that influencers nowadays have started to share their views and experiences depending upon the use of serums and products they're using. But I would still recommend that always ask your dermatologist whether whatever product, even you are willing to apply, should always be discussed. Yeah.
Okay, so you should always go to a qualified dermat rather than going for, over-the-counter drugs or going by what the influencers are asking you to do. Go to a reliable person with who is a skin expert, which is a qualified dermat. Now, doctor, when a person comes to you with acne, now, do you recommend test or anything? Because of course you can, say that yeah, this is acne, but then what kind of acne or what are the causes of acne to diagnose all that? Do you recommend any test or how do you do that?
Yes. Since we have discussed about the location, the areas of the acne present,
Hmm.
so we have to analyze the face, and even if it is present apart from the face or not. So according to that, we have to channelize the investigation also. We have to, if the person is having, first we have to ask them if they want. Then we have to, if it's POD related, then we should always look for the FSH and LSH hormone. If it's related to any, if you are doubting it to be something related to the organ, always the organ profile done. Otherwise, if it is depending upon the history, again we have to ask them if it is occurring around the nasal area, around the nose area, or periorbital area, or sometimes it occurs over the nose and the cheek area. So whether the person is on some other medications already or not. So that we have to do.
Right. And what are the treatment options available?
It depends upon the staging of the acne first. Like if the person having only comedons and that too less of papules are there, only topical creams will do. Topical creams per se, retinoids, little bit of benzoyl peroxide application will do. If it is containing papules and pustules in it, then we have to start with little aggressive treatment, including antimicrobials in it. And sometimes if it has pustules also, then we have to start with the oral antibiotics along with other this thing. And then if there is nodulocystic acne, then we can also switch on to oral isotretinoin. Initially, to give the therapy along with the antibiotic. If not, then individually isotretinoin will work. Apart from that, if there is no treatment respondent from the patient side, or if there is no response, then we may switch on to corticosteroids also in case of the very severe this thing, acne conglobeta. That is the severe form of the acne. And also sometimes dapsone is the last spot in case of oral medication.
Okay. Now, doctor, what happens that when a person comes to you, of course, the very first question that they'll have in their minds is, when will I get a acne-free skin? Now, in the process, they realize, and everyone who had gone through this acne phase, they realizes that treating acne is one thing, treating the acne marks or scars is one thing, and that sounds to be more challenging. Now, my question to you is: A, how can we prevent from those marks and scars? I mean, the acne just subsides and get treated without any marks and scars. And B, in case we have that, what are the procedures available to treat that?
Okay. See, these acne scars also, if we start to talk about it, it will take a but then, according, we have to first start with the retinol for a little bit of skin, and then we have to take care of the patient that whether his skin can or not. But if he really wants to go for the surgery or procedure side, one of the best is non-ablative radio is MNRF, microneedling. So really for the acne scarring, we can do, if there are very little scarring, we can do the subcision for the depressed type of scars. If the scarring is there, then we can also go for the photodynamic therapies and also lasers sometimes, which include the ND-YAG as well as Abraham-YAG laser. Fractional CO2 laser is also one of the good treatment available for the acne scars. Apart from that, these, you must have heard of these green, blue, and red lights. So they also plays a role in remodeling of decrease the pigmentation of the acne scars. Apart from that, yeah, there is also one this photodynamic therapy with amino levulinic acid, which is like very less used. It is being used 1 hour before the LLLT. These blue, green, uh, red lights. What I'm talking. So these are the treatments. And for the very stubborn pigmentation and scarring, we can also go for the intralesional steroids, but very lower doses.
Okay.
Much enough
Uh,
for scarring. Yeah.
Yeah. Now, many times, people who have acne prone skin or who have oily skin, they'll complain that my skin already produces so much of oil. Do I still need moisturizer, or do we still need to layer up our acne with sunscreen? How important role does moisturizer or sunscreen plays in managing acne, or this is something we can avoid? People with, acne prone skin can avoid.
Uh, See, person is acne treatment. So of course, there's a products, for the acne prone skin, which causes more of dry, redness, and body sensation. So to combat that symptom, we have to use moisturizer to maintain the hydration of the skin. Otherwise, it starts to feel very dusty. Moisturizer, that we have to always check label that moisturizer which has fragrance, contains alcohol, which contains acetone, in it, which contains mineral oil should not be used. But moisturizer which contains wheat germ, okay, which are lightweight, which contains oatmeal extract can be used for in case of this.
And for people with sensitive skin, in case they have acne, what to do with that, doctor?
So people, first of all, if they have sensitive skin, they should use the moisturizer to prevent damage of the, because already products we're using is breaking the skin, right? Breaking the comedones and whatsoever. So we have to prevent the barrier damage so that skin heals faster, right? So that has to be done. Moisturizer is one thing. To combat the pigmentation, which is being caused by the product that the person is using, because the person can be sensitive, the skin can become photosensitive with the exposure of UV rays. So should apply sunscreen on the daily basis, which should be non-comedogenic again. And in that case, if the person is having sensitive, he's having acne prone skin, physical sunscreen is the best because it doesn't absorb and it makes the layer over the top of the skin and evades the damage whatsoever comes by. So that is one thing. Apart from that, one should wash the face regularly, but what not too frequent is again, damaging the barrier. And do not use body towels on the face. Do not use any infected towel on the face. Use disposable tissues to clean or wipe off the face. And apart from that, then again, avoid touching it because you're sensitive. If you're again you touch.
Today we are talking about acne management, and Dr. Farheen Khan had given us such good insights about how to manage your acne, what products to use, what kind of product to use, how to choose for the right kind of cleanser, moisturizer or sunscreen. And for an issue, her only recommendation is to go and consult qualified dermat rather than just going for over the counter medication or going by the influencers. It can be really so. We have with us Dr. Farheen Khan, and who is a dermatologist and practices at Rudrapur, and she discussed that how we can, have acne-free skin. So, doctor, it was a very, very good conversation that we had. In the end, just few words as a take-home message for our viewers. Anything that you would like to say before we conclude?
Yeah, definitely. So I'd suggest usually, they tend to scrub their face. Should always avoid scrubbing and do not apply oil on the scalp, especially, and should never use any product without dermatologist. And even if you're willing to use any product, always discuss it with the doctor and go for it. Yeah, touch your face. Apart from that, please, please stay hydrated. Thank you so much for giving me opportunity to speak over this platform.
It was such a pleasure to have you with us, Dr. Kareem. And thank you so very much. And viewers, thank you for your active participation as well. Thank you, doctor, and have a great day ahead.